Okay, so what we're looking at today was looking at myofascial pain syndrome and myofascial trigger points, which is what I've come to conclusion of your diagnosis. So have you ever heard of a myofascial trigger point? No. So a myofascial trigger point is it's a tight spot in your muscle, so where all your muscle fibers have contracted, and what happens then is that tight muscle spot, so that hyper-irritable spot in your muscle fibers, will generate pain, which is myofascial pain syndrome. Okay, so an effective treatment against myofascial pain syndrome and myofascial trigger points is dry needling. Okay, so have you never heard of dry needling before?
No.
So dry needling is the application of acupuncture needles directly into the myofascial trigger point. So it's believed that the insertion of a needle into that trigger point zone in your muscle will cause microscopic damage to the muscle fibers in that tight spot and release them. Okay, so that release will in turn decrease the pain receptors that have been affected by the tight spot, and also will increase blood flow to that spot of your muscle. Okay, so there's been multiple studies done on dry needling and its effectiveness. All the patients used in every single study that they've assessed displayed similar symptoms to yours, ranging from ages 18 to 60 years old. All the patients included in these studies were put through a screening process where they were palpated, so they were assessed by palpation, which is pretty much just touching and feeling where the muscle trigger point is. And then from there they were separated into groups, and some were applied dry needling and some went through placebo. All the patients that were put through dry needling showed significant improvements with range of movement, and they all showed a decrease in pain significantly compared to the people put through the placebo treatment. So dry needling as a whole is extremely effective. They've done trials on dry needling against other methods of treatment against myofascial trigger points like massage, and there's been a significant difference in the results of people getting dry needling compared to people getting deep tissue massages. So I believe that the correct treatment for you today would be dry needling, and it will definitely help you with your shoulder pain and your neck pain. Okay, does that sound good?
Sounds good.
All right, no problem.